All right, I'm gonna knock and enter the patient's room and introduce myself. I am Becky Crabtree, and this is my second injection video. And this one is subcutaneous insulin injection. And so I'm going to introduce myself to the patient, and I'm gonna go over the 6 medication rights, which are the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So, and then I'm going to check the doctor's orders to make sure it is truly what the doctor has ordered. And also check her MAR, her medical records, to make sure she's not allergic to anything, and that this is truly what is requested. When I enter the room, I'm going to ask her to verify who she is, her name and her date of birth. Can you tell me your name and your date of birth? Ramona, 8475. Perfect, and I'm going to verify on her wristband that that is correct. And then since this is insulin, we would do a glucose check to make sure, and then depending on the doctor's order, whether it is standard unit or if it's going to be a sliding scale, we would note that as well. When we pick up the insulin, we're going to check to make sure it's the right kind of medication, the date and the time that it was, if it's a multi-use vial. To make sure that it is within 30 days before we administer it. Make sure that it's not cloudy if it shouldn't be, and if there's no particles or anything in it. Once we're ready, we will go ahead and clean off. Well, first we're going to roll the vial just to mix it. We don't shake it, just to make sure that there's no sediment in the bottom. And then we're going to wipe the top. If you were to mix, if you were using 2 different kinds, you would start with the clear and then go to the cloudy when you're in loading up your syringe. So I'm going to take the syringe. We use a 100 unit syringe, up to 100 unit in this particular video. And I'm going to check, make sure that it's working here. And today we're going to give 10 units. And then the size needle is a 26 to 28 gauge needle. So I'm going to draw it back to 10. I'm going to insert it at an angle here. I'm going to inject the 10 units of air. Turn it up 90 degrees. And again, are you following me here? Make sure that it's 10 units. Then we're going to withdraw it. We're going to do the 1 hand cap recap method. Click it into place. And then we're going to verify over here with our second nurse, making sure that this really is 10 units. Yep, looks great. Okay. And then we're going to come to the patient and explain the procedure, what we're doing. Let her know that we're going to be injecting insulin. There are a few different locations that you can inject insulin. One being in the back of the arm, the other one being in the gut, and then the upper buttocks area. Those are, today we're going to do it in the back of the arm. So. But our arm is right here in the form of an orange. So again, we're going to take an alcohol prep. And we're going to start on the inside and work our way out. And again, let it dry before we inject. And we're going to uncap it. We're going to squeeze. If they're a very obese patient, we would go in at 90 degrees. If they're not, we would go in at a 45 degree. And I am going to go in at a 45. And you go in and you inject it slowly. And then withdraw the needle. Put it in the sharps container. And if it has a little blood, you dab it. Don't rub or massage it. And they are good to go. Then I'm going to record how much insulin I gave them, what time I gave it to them, and where, making sure the location is also noted in the patient's medical records. And that is that.